the JAMA Network.
Maureen Rottenberg still remembers crossing the line into drug addiction.
I spent probably a good 25 years actively using.
Today she is celebrating almost 6 years clean, but remembers that getting help was hard to come by.
It's hard to ask for that help, especially if you don't know that there is help.
People with addictions receive among the worst quality care in the health system. They have a chronic condition that often relapses, and they often don't seek help.
Dr. Richard Saitz from Boston Medical Center and co-authors conducted a randomized trial. People with alcohol and other drug dependence were divided into 2 groups. For 1 year, one group saw a physician and received information on where to get additional help for their addiction. The other group, including Maureen, received regular visits with a nurse care manager, internist, social worker, and psychiatrist.
I liked that everything was here at the hospital for me. I had the nurse, the doctor, I had group therapy here, because that was the beginning of my being able to recover.
At 12 months, about 2 in 5 told us that they were not using opioids, not using cocaine, and not drinking heavily.
The study appears in JAMA, Journal of the American Medical Association.
What we were disappointed by, frankly, was that the people in the chronic care management group and the people in the control group who got usual primary care, they both reported abstaining at those levels.
Chronic care management was no different from usual medical care. Researchers say one reason for this may be that a number of participants had problems beyond just addiction. Many had spent time in a shelter, suffered depression, and post-traumatic stress disorder.
So it may have been that the population was just so severe that chronic care management wasn't enough to help them.
The program was enough, however, to help Maureen. She is living in her own apartment and is continuing to work on rebuilding relationships with her family.
Life is good today.
Catherine Dolf, the JAMA Report.